These bruises were popping up all over.
It occurred to me that people think I'm abusing my child.
It was very shocking.
I was getting more lumps on my back, my thighs, and my abdomen.
He was devastated. We didn't know what we were going to do.
Next, two medical mysteries that defied the experts. When Helen and Alan Smith bring their newborn daughter home, they have no clue that within just weeks, they'll be in a desperate fight to save her life.
It was a scene out of a horror story. Her whole face was covered in blood. I was terrified.
Then, Jake Tate, a young Air Force sergeant, is at his physical peak when a series of mysterious growths appear all over his body, putting his career and life on the line.
I would be in so much pain that I would literally vomit. I said, I can't live with this any longer.
In the winter of 1998, Alan and Helen Smith were excited about moving into a new home just outside of Birmingham, Alabama.
We had two children, Taylor, who was 7 at the time, and Millage was about 6 months old.
Helen had her hands full caring for the children, while Alan spent his days focused on his graduate school studies.
Helen was often left at home taking care of the kids all by herself.
Then we got a huge surprise. I was shocked to discover that I was pregnant with my third child. I was concerned because I was already extremely busy with the two of them.
Once the shock wore off, we began preparation and planning for a baby girl.
On October 5th in 1998, I went into labor. We arrived at the hospital at around 11 o'clock, and by 11:21, Julia was born. Her delivery was much quicker than any of my previous deliveries. My doctor immediately handed her to me. She had all 10 fingers, all 10 toes. She looked perfect. But as I was looking at Julia, I noticed that she had some little purple polka dots on her face, her neck, and her torso. It looked like she had blueberries sprinkled all over her. And then when I turned Julia over, I immediately noticed that she had bruises from the base of her neck all the way down to the tip of her bottom.
We were very concerned at this point. We could not believe what we were seeing.
Alarmed, Helen and Alan asked the doctor why Julia has the strange marks.
He explained at that time that it's not unusual for there to be some birth trauma to the newborn through the birth canal.
He said she shot out like a rocket, and so she must have bumped her back along the way. The doctors weren't concerned about the bruising, and we were discharged and sent home. For the next couple of weeks, she was doing well. All the bruising along her back seemed to be healing correctly.
But it's not long before Helen notices a frightening new development.
When Julia was 3 weeks old, I was going to change her diapers, and as I was doing so, I noticed that she had what looked like fingerprint bruises along her torso and her rib cage area. And that was quite frightening. I had never seen anything like that on any babies before. I figured out the only way she could have gotten those was just from me picking her up. I knew I had not handled her roughly at all. I knew that something was really wrong with Julia.
Because I was in Birmingham, 30 miles away, I urged Helen to take Julia to the pediatrician close to our home. I was concerned that perhaps we were dealing with something more than just birth trauma.
The doctor wanted to know if anybody in our family bruised easy, and I told him that I did have a history of bruising easily. He kind of just explained it away as she probably just inherited that from me. And, you know, just be a little more careful. He didn't seem to be concerned because everything else about her seemed to be normal. And I believed him. He was the doctor.
But just a week later, while Helen is bathing Julia, she sees something that stops her in her tracks.
I noticed that she had a small circular bruise on the bottom of her foot. As I continued to bathe her, I noticed that she had a similar looking bruise inside of her ear. I thought that was very odd because she was not walking or even crawling yet.
Determined to find out what's wrong with her newborn, Helen contacts a new pediatrician.
He examined Julia and ordered a blood test. He was checking for her platelet count to check for some of the more easily recognized blood issues that children are born with.
The doctor suspects Julia might have idiopathic thrombocytopenic purpura, a disorder in which the body doesn't produce enough platelets, a type of blood cell essential to the clotting process.
Waiting was hard. I just wanted some answers. But the results came back, and he told me she checked out fine.
Julia's platelet count was normal. He seemed to feel that Helen might be overreacting.
He told me I had a case of new mom nerves, but Julia wasn't my first baby. I had 2 other children who never had any of these problems. I was a little bit frustrated by being dismissed so easily by her pediatrician. At that point, didn't know what else I could do other than really try to protect Julia a little bit more. So every place that she was in the home, her crib, her baby carrier, her car seat, I just made sure that there was extra padding. I pretty much treated Julia as if she were a very fragile egg. If I could have bubble wrapped her, I would have. The hardest part was to keep her 16-month-old brother from accidentally injuring her. I kept thinking if simple act of me holding her gently would cause bruises. What would happen if he accidentally hit her with a toy? It was difficult because it was an unnatural feeling to keep siblings apart, and he was so curious about his new baby sister.
Over the next few months, Julia hits all her milestones right on target. But the more active she becomes, the more she seems to be hurting herself.
She started scooting around the floor, and her knees and hands in particular always had bruises on them. She always had an average of at least 10 bruises on her body at this point, and we're talking about a 5-month-old baby.
I have a memory of looking at Julia one time, and Helen and I commented she looks like a leopard because of her spots.
But she did not appear to be in any distress at all. She was just happy little Julia, smiling through it. It was bizarre.
Confused by it all, Helen grows even more worried after an unsettling incident at the supermarket.
I remember this one lady, she started to approach our cart to go, "Oh, what a cute baby." Once she noticed Julia's bruises, she cut her eyes and gave me the meanest look and then just walked away. It was my light bulb moment where it occurred to me that people think I'm abusing my child. It just broke my heart.
Frightened and not sure where to turn, Helen reaches out for support. She takes the children to visit her parents in Augusta, Georgia.
I saw the bruises and I realized what Helen was going through. Helen had described them, but seeing it in reality was very shocking. Probably about 60% of her body had bruises on it.
Little do Anne and Helen realize the worst is yet to come for 6-month-old Julia.
Our very first night visiting my parents, I woke up to Julia's cries. I picked her up and felt that she was wet. And when I turned on the light, it was my worst nightmare. It was a scene out of a horror story. Her hair was matted with blood. Her whole face was covered in blood. Her clothes were completely saturated. I was terrified.
In August of 2006, 20-year-old Jake Tate, a one-time star basketball player, was focused on winning something bigger than a game. The girl of his dreams.
Heidi and I met at a restaurant we were both working at in Knoxville. I knew she was the one.
Jake was very athletic. He's a very good-looking guy. He's 6'6", and he has one of the most determined, hardworking natures, and he won't let anything stand in his way.
I asked to take her to dinner after work, and she introduced me to her son Benjamin.
And when I saw how sweet he was with Ben, it was just immediate.
Heidi and I dated for 9 months before I proposed. We got married in Vegas on May 29th.
And almost as soon as they return from their honeymoon, Jake makes a momentous decision.
I knew that I had to have a better job to support my wife and child. So in June in '07, I decided to join the Air Force to do tech school for meteorology. After basic training, I was stationed in Biloxi, Mississippi. It's kind of like really strict college. You go to class every day and you learn how to forecast meteorology. To think that you complete 2 years of college in 8.5 months is pretty crazy. I would wake up at 4 o'clock in the morning, get ready for school, and the day ends about 3 o'clock. And then you do PT till about 6. It's constant physical and mental strain.
Over the next several months, Jake slowly adapts to the demanding routine. He has no clue that his life is about to spin out of control.
I was in the shower and I noticed that I had a small lump that was the size of an eraser on a number 2 pencil. It was protruding from the right side of my abdomen. I thought maybe I hurt myself exercising. I just kind of thought it'll go away.
Putting the strange growth out of his mind, Jake throws himself into the training program harder than ever. But over the next month, a dozen more lumps begin to form on his abdomen.
The lumps were kind of like small marbles underneath my skin. If I just kind of put my finger on one, put a little pressure behind it, it caused me a lot of discomfort and a lot of pain.
I first noticed that there was something wrong with Jake when he was rubbing his side and making a face. And I could feel that there was definitely a hard knot underneath the skin. Almost felt like a cyst of some kind.
I thought, well, can't be that big a deal. It's probably stress or something, because this is the most stress that I'd ever felt in my life. And I just didn't really want to go to the doctor.
But as winter drags on, more and more painful lumps appear at an alarming rate.
By that time, I probably had about 40 lumps. To cope with the pain, I started using a heating pad at night. I also would take hot showers and hot baths, and it really helped.
It was important to me that Jake seek medical help because at this point it was obvious that this was something that wasn't normal.
I really just didn't want to go to the doctor, and I was going to continue to do what I'd been doing, ignore them, because I was still so young and new in the Air Force, and I was afraid that something like this could possibly get me kicked out.
Determined to maintain his status in the Air Force, Jake focuses on his studies, and in the spring, he graduates with flying colors. Soon after, he lands his first military assignment.
I moved to South Carolina to Shaw Air Force Base to start my job as a meteorologist.
When we initially got to South Carolina, there seemed to be a pause in the symptoms.
It was a lot more warm and dry in South Carolina. The heat and the lack of humidity and the lack of stress as I had learned my job and I was doing well at it. And so I started feeling a lot better. The lumps would become smaller in size and they would hurt less.
We thought maybe it was just going to take care of itself at this point.
As the lumps seem to shrink with each passing day, Jake and Heidi breathe a huge sigh of relief. Unfortunately, the reprieve is short-lived.
In late October, early November, I was getting more lumps. On my back, my thighs, and my abdomen.
These symptoms that he was having came back as strong as they had ever been before we left, and for the most part worse.
At this point, we actually started counting. Heidi and I would go through and take a highlighter and mark each lump I've had about 60 of them. The hurt was like a stabbing sensation.
He was in such extreme pain that he was almost in tears. And that's just not my husband.
There were some times when I would be in so much pain that I would literally vomit. I would start throwing up because I hurt so bad.
He was withdrawing himself from the family, and he was short with us, whereas he would never have been that way before. I suggested that Jake go see a doctor. I was pushing him to go. But Jake was in complete denial about it, and he didn't want to think about it. He didn't want to talk about it.
I really didn't want the Air Force to find out. I was afraid that they would take away my job. I was afraid that I would get in trouble at this point because I'd kept it quiet so long, and there's not like you wake up overnight and have so many lumps.
At this point, our lives and his life had been totally turned upside down. He needed to go to the doctor.
Since birth, Helen Smith's daughter Julia has been suffering from strange black and blue marks that seem to appear randomly all over her body. Now, Helen and her mother Ann have found the newborn soaked in blood.
As we cleaned her up, we couldn't find the source until we got the very last speck of blood off of her face. And all of that blood came from a tiny nick that she had caused with a fingernail on her face.
We got to the emergency room, and the doctor examined Julia. We were hoping someone could give us some answers.
He did a general examination. He listened to her history of everything we had gone through and suspected that she more than likely had a bleeding disorder called von Willebrand's, and he ordered blood tests.
Von Willebrand disease is a common blood disorder in which the body lacks an important clotting factor. It is easily managed and treatable with medication.
I just needed to find out what was going on. And so I kind of was hoping that that's what it was. The not knowing of exactly what you're dealing with is so hard.
2 long hours later, the doctor returns with the test results.
He came back and said, well, no, it's not von Willebrand's. Her hemoglobin's good, everything's fine. I don't know what it is, but it's definitely not von Willebrand's.
So it left us with no answers whatsoever. Helen was devastated.
I felt like people were thinking I was hysterical or overreacting, and I knew I wasn't. We just didn't know what it was.
Desperate to find out what's wrong, Helen and Ann decide to take matters into their own hands.
I worked at a medical college laboratory that did advanced testing on blood. They were doing a clotting test that was beyond what the ordinary laboratory ran. And Julia had not yet had that test.
The very next day, they bring Julia to the medical lab so Ann's coworkers can administer the test.
The results showed that Julia's platelets did not work correctly. That test wasn't specific about what exactly was wrong with Julia, but at least we knew we were on the right track.
We were in a desperate search for a pediatric hematologist who knew something about what was going on with Julia. We were referred at that time to Dr. Lightsey, who was in the pediatric hematology clinic.
Within hours, Alan has set up an appointment with Dr. Alton Lightsey.
I first met Julia when she was 6 months old. There were certainly bruises at various stages. I have not seen a patient that young with those symptoms. In the past, the multiple blood tests performed on Julia were within normal limits, and that included a platelet count, which was normal. Eventually, the test to look at how platelets work, that was clearly abnormal. And so we finally had something to point at as the cause for the problem. With this information, we had a hunch what we were dealing with. And I wanted to do one last blood test to try to confirm that diagnosis.
Waiting for the results felt like forever. I was looking forward to having some kind of relief.
And it did take about 10 days before we got our answers. When we received the results from the special test, it documented that Julia had Glanzmann's thrombasthenia.
Glanzmann's thrombasthenia is a rare genetic blood disorder. In healthy individuals, proteins on the surface of platelets allow them to link together and coagulate. But in patients like Julia, these proteins are missing or malfunction. As a result, platelets slide off one another and aren't able to form a solid clot.
If a person cuts themselves and starts bleeding, the platelet has to go to the injured tissue and it sticks to the tissue. And this is where the problem is for Glanzmann's thrombocythemia. Platelets can adhere, you cannot form a solid clot, and that's why you continue to have bleeding or exaggerated bruising.
Helen and I were elated when we finally had a diagnosis for Julia.
It was a relief to know that all of the symptoms that Julia had a logical explanation.
In retrospect, reviewing the case, all of Julia's early symptoms were related to the Glanzmann's thrombocythemia. During delivery, there is significant trauma, and basically you can have bruising in a perfectly healthy child. In her situation, she had exaggeration of these bruises, and this all suggested that she had an underlying bleeding problem.
And the normal bumps and bruises of daily life were too much for Julia's platelets to handle.
We just take for granted how our body is able to respond to any kind of minor injury. Even when you walk around, you can actually stretch tissues and cut a vessel. What happens is you get a little bit of blood that goes out into the tissues, that breaks down, and that's where you get the discoloration for a bruise.
But patients like Julia aren't only susceptible to extreme bruising. They tend to bleed profusely, even from small cuts.
He told us how she bled that much from just a little teeny tiny fingernail cut on her face.
What had happened was that Julia had scratched her face, and because these platelets weren't able to work well, they just continued to ooze throughout the night.
As terrifying as that episode was, it didn't represent the real threat to Julia's health.
Unfortunately, in a situation where you have an abnormality like Glanzmann's, the greatest risk is internal bleeding.
It is the nosebleeds, the GI bleeds, that you cannot treat directly, that are the life-threatening bleeds because you cannot stop them.
As scary as it was to get the diagnosis, it was also good to know that now we knew what we were fighting. We just wanted to know what this meant to Julia.
Over the last year, strange lumps have been growing rapidly all over Jake Tate's body, but he still hasn't seen a doctor. Afraid that a medical problem will disqualify him from his Air Force job, Jake is determined to live stoically with the mysterious, painful disease. But it just keeps getting worse.
My lumps seemed to hurt more. They started getting extremely painful.
I was pushing him to see a doctor. I threatened him and told him that I was going to go and tell his supervisor.
And so I decided it would be best to go ahead and go to the doctor.
In the winter, almost a year from when the first lump appeared, Jake finally schedules an appointment off base.
When I went to see the dermatologist, I had 156 lumps. I said, I can't live with this any longer. And I explained to him, anytime I put pressure on him, I'm in excruciating pain. He said that he had never seen this many lumps on one person. He was shocked. The dermatologist told me that the best idea would be to biopsy him, just to make sure that there was nothing else going on. And I thought, maybe it could be some kind of cancer.
I thought about my husband and whether or not we're going to be able to be 70 years old and walking down the street together. But I had to put those kinds of thoughts out of my head because it can devastate you.
Finally, after an anxious 48 hours, the test results are in.
He could tell that it was non-cancerous.
It was an overwhelming relief.
And he told me they were lipomas.
Lipomas are fatty lumps. They are usually not painful, and their cause is unknown.
The dermatologist said they're not really sure why they form, but if they're irritating you, then we can start cutting them out. And if we do them in 2-week increments, it shouldn't take us more than a year to get all of these out. It seemed like a dream come true that this guy could solve my problem so easily. So I was gung-ho. I went back the next week, and then he proceeded to give me a local anesthetic around the area. We cut 2 out that day.
We were hopeful that everything was going to be easy and life would go back to normal.
But just when Jake thinks he has things under control, he goes in for a follow-up visit and finds himself blindsided by a horrifying new development.
The spot where he had taken out the first 2, there was about 4 to 5 lipomas, or lumps, where the 2 original had been. They were multiplying. It was like a piece of popcorn, where it's just a bunch of little bulbs sticking out off the sides.
We were shocked as to what was going on and why it had happened right in that same spot. Jake seemed very disheartened and frustrated.
At that point, I asked if there was another treatment that I could look into. Since they were growing back faster than he could cut them out, he said that what I might try is liposuction.
Determined to leave no stone unturned, Jake and Heidi immediately set up an appointment with a plastic surgeon.
The plastic surgeon did a thorough exam and said that I did have a lot of lipomas. It wasn't something he had seen before, but it was pretty rare to have that many that were causing pain.
The plastic surgeon told us there was absolutely no way that liposuction would work. That if they were multiplying from having them removed, that it would only be worse with liposuction. He basically said that there was nothing that he could do for him. When Jake left, he was devastated. The weight that we thought was going to be lifted was 10 times worse because now we didn't know what we were going to do.
I was in a lot of pain constantly, and things were only getting worse.
And then I said to him that maybe we should make another appointment to go see the doctor on base. And so that's when he went and he met with Dr. Judy.
When I first saw Jake, he was scared, overwhelmed, and a little despondent. He was looking for answers. I took a history, and then one by one, he showed me where he had these painful lumps.
When I saw Dr. Judy, I had about 200 lipomas.
Jake had lipomas all over his body, from his arms to his chest to his abdomen to his legs, on his back, and they would range in size from a pea all the way up to a golf ball. I was overwhelmed. I'd never seen anything like it before.
Helen and Alan Smith have just found out what's been causing their newborn daughter, Julia, to experience harrowing bouts of bruising and bleeding. Glanzmann's thrombasthenia, an extremely rare blood clotting disorder. Now they're desperate to know what they can do to get the disease under control.
Unfortunately, there really is not a cure, and there's no medication that can correct this abnormality. We try to use a lot of preventive approaches to try to minimize the chance of the child having bleeding episodes.
The only thing we really could do was keep her in a safe environment, make sure that Julia never participated in contact sports.
Besides placing a limit on her physical activities, when Julia reaches puberty, she will need medication to keep her from menstruating.
Glanzmann's would really put you at a significant risk to have significant period bleeding to the point that you could die.
Just even beginning a cycle could set off a bleed that would be hard to ever get under control again.
There are hormonal medications that can be utilized to control the bleeding.
It'll be like the equivalent of taking anywhere from 4 to 8 birth control pills a day, every day, for the rest of her life.
While they will be able to keep the risks associated with menstruation in check, the Smiths must now face a devastating truth.
Certainly in a pregnancy, the bleeding that occurs postpartum can be very life-threatening, and so it is recommended that Julia not have children.
At this point, I was scared out of my mind. But Dr. Lightsey was extremely optimistic and reassuring that she could live a long and healthy life. But it would require work and attention on our part.
As they prepare to face the challenges ahead, Helen and Alan can't help but wonder why so many medical experts fail to identify the dangerous disease.
Well, there are less than 1,000 cases in the world. It's a very uncommon condition, and a lot of doctors have never seen this diagnosis.
Over the last year, more than 200 agonizing lumps have surfaced on Jake Tate's body, and no doctor can explain what's wrong with him. Now he's in the hands of Dr. Carrie Judy, who is completely shocked by what she's seen.
Never in my life had I seen a patient with that many lipomas before. Anytime I would touch any of his lipomas, he would wince, and I wasn't honestly quite sure what to do. I was very concerned because I knew that Jake was active duty military, and you have to be fit to fight, and I knew this would impact his career if there wasn't a cure.
But before she can deal with Jake's future, Dr. Judy needs to get his pain under control.
She prescribed him pain medication that helped him feel better.
And I tried to find out if there was anybody that knew more about it than I did.
After leaving Dr. Judy, I was definitely a lot more positive.
Over the next 2 weeks, she spends countless hours trying to put the pieces of the puzzle together. And now, Dr. Judy thinks she may have found an expert who can answer all of their questions. Dr. Karen Herbst.
She actually specializes in fatty disorders, things that are a little bit rare and a little bit more difficult to treat.
We scheduled an opportunity for me to meet with Dr. Herbst. That was a great feeling. Dr. Herbst did a full body exam. She went over every lipoma and checked me out from head to toe.
When I examined his trunk, he was exquisitely tender. When I would touch him, he would wince and shift his body. Based on Jake's painful lipomas, I gave him a diagnosis of Derkham's disease.
Derkham's disease is a rare disorder in which the body forms acutely painful lipomas. In a healthy individual, small amounts of fluid containing toxins continually leak from blood vessels and are easily flushed out of the body. But in patients like Jake, for some unknown reason, too much fluid is released and settles between cells, creating inflammation. To clean up the toxic fluid, the body sends blood cells to the rescue. And to feed those cells, it produces fat, which gradually builds up into solid growths.
If you have a vessel that leaks fluid, that fluid should normally leave, but if it doesn't, then it's going to sit in that area and stay. It's like you take the garbage out to the street, but it never gets picked up by the garbage truck. So it starts to almost ferment in the tissue. It becomes more and more toxic, and it sends signals out to cells called macrophages to come in and clean up the mess. They eat up all of the garbage that's in the tissue. These macrophages need to have food themselves. So the fat in the areas of the lipoma most likely grows in order to feed the cells that have accumulated in that tissue itself.
My gut reaction to finding out that I actually had Derkham's disease was to jump up and cheer. I was really happy that I found out what was wrong with me.
I thought about where we were going to go from here. I was hopeful for the future.
While much about Derkham's is a mystery, Dr. Herbst is one of the world's foremost experts on it, and she suspects that Jake may be genetically predisposed to the disease.
My understanding is likely there's been a mutation in a gene that's passed down amongst family members, and that causes the blood vessels and fat tissue to respond differently to inflammation.
Dr. Herbst also has a theory about what triggered the onset of Derkham's in Jake's case.
He had just undergone boot camp and an extreme amount of physical activity. When you undergo physical activity, you produce a lot of lactic acid, and then it's taken to the liver and it's metabolized. Well, in someone who has Derkham's disease, the lactic acid is released outside of the cell, but then it just sits there.
And the more Jake exercised, the worse his symptoms became. But surprisingly, they improved during the hot summer in South Carolina.
The heat probably helps Jake because it dilates the blood vessels, and dilation actually draws more fluid from the tissue back into the blood vessels, and it gives a little bit of relief to the nerves during that period of time.
But even physicians on the cutting edge of research like Dr. Herbst don't understand why Derkham's is so painful. However, she can explain why the lipomas multiplied when Jake had them surgically excised.
When you remove the lipoma, you leave behind an area of inflammation. Whenever there's inflammation, there's an over-responsiveness of the body. Inflammation in the area of surgery stimulates leakage and fluid to accumulate. So having lipomas removed in Derkham's disease causes a vicious cycle of growth of fat.
Despite the harsh reality of the disease, Jake is aware that his prognosis would have been dire if he hadn't been diagnosed when he was.
The worst case scenario with Derkham's disease is somebody who is unable to handle the excess amount of fluid in their body. So as the fluid builds up over time, it also fills up in the lung, and that can actually lead to death.
The grim truth is there's no medication that can shrink the lipomas, and no surgery that will permanently remove them.
Unfortunately, there is no cure for Derkham's disease.
This is a lifelong problem, so these should continue to grow over time.
When the realization hit that Jake was going to have to live with this disease for the rest of his life, and that the lumps were going to continue to multiply, it's devastating.
I wanted to cry because I knew that this was going to be a long, hard battle.
But Dr. Herbst also has some good news for Jake and Heidi. There are ways that they can manage the symptoms.
I can make a number of recommendations to possibly decrease some of the fluid in his tissue and enable Jake to have as long of a life as somebody who doesn't have Derkham's disease. He should avoid physical activity, and he needs to decrease the amount of stress in his life.
He has to change every aspect of his life.
While Jake is grateful to finally know how to cope with his devastating condition, he can't help but wonder why no other doctor was able to give him a solid diagnosis.
We really don't receive education on how to diagnose fat disorders. A doctor would look at it and say, you have multiple lipomas, don't worry about it, go on home.
Today, Julia is 11 years old, and while she continues to bruise easily, she's living a very full and miraculously active life.
Although I have band spins, I don't let it hold me down. I love to ride my scooter a lot, but I usually have to wear my helmet.
We've really made an effort to allow Julia to experience those things that she wants to experience within reason, and kept her abreast of everything to do with her disorder.
She can live a happy life. She'll never be normal, but she can be pretty close to normal.
When I grow up, I still want to be a mom. Although I can't have a baby, I would like to adopt one so I could have a child, and so that that child would have a home.
Julia's the strongest person I know. I don't know too many people that could go through the things that she goes through and come out as good as she has. She's a fighter.
Today, Jake is bravely living with his condition. Unfortunately, he may have to give up the job that has meant so much to him.
I really don't want to leave the Air Force, but I'm not able to do all the physical things that I was before.
Jake's case is currently under medical review to determine whether or not he'll be able to continue serving in the military. In the meantime, Jake and Heidi are focused on raising their family. They now have 2 children.
It's really important to me to be a role model for my kids. As a father, my sons especially look up to me.
I know that this is something that is going to be with us forever, and I really hate that for him.
My wife and I recently just counted again. I'm up to 815 lipomas now. Currently, I'm taking 2 different kinds of pain medicine. It helps me be able to perform everyday tasks like pick my kid up. And so the medications have definitely helped with stuff like that.
Despite the uncertainties they face, Jake and Heidi are closer than ever.
Everything that's happened has made our marriage so much stronger, and it made me love him so much more.
I had learned always search for the answer that fits for you best. Never give up and try to stay positive.
We're optimistic about the future. We're going to try to make the best of what we've been given.